welcome. I'm Peggy. And today we're going to talk about how to be healthy, good health. And there are things that we can do, simple things. Sometimes they don't cost money. They can make a difference in how we are and how we can manage to keep ourselves healthy and our children. And I'm very pleased and grateful to have Dr. Amanda O'Kelly here with me. Now, Amanda is a South Carolina girl. I believe you say Simpsonville.
From Simpsonville, yes.
She is a medical doctor, and she is here on behalf of the Heritage, is that right, Heritage Pediatrics and Internal Medicine,
Yes.
which means you treat not only children but whole families.
Correct.
And that is part of our Greenville Hospital System and University Medical Center.
Yes.
And we do have a phone number, so we can put that up. So you want to talk about some health issues and simple things that we can all do.
Right. It's so important to start those healthy habits at a young age and really continue them throughout your lifetime, because the things that your kids are eating and the activity or lack of activity that your child is doing now really affects them for the rest of their life. So it's important to start at a young age. But at the same time, if you haven't started those healthy habits at an early age, it's never too late.
It's never too late to get better, is it?
Right, absolutely. So big things that we really try to encourage are healthy eating. So lots of fruits and vegetables, so at least 5 servings a day of fruits and vegetables, and trying to limit the amount of saturated fats and other fats that are in your diet. Specifically, saturated fats being less than 7% of your total intake of calories on any given day. Trying to limit the amount of sodium in your diet, which is found in a lot of processed foods. And choosing those lean meats and lean proteins. Fish is a great source of protein and actually has the healthy fat that can improve your good cholesterol in the fish. So if you can get 2 servings of fish every week, that's great for your heart health as well.
So fruits and vegetables, eat fish, and you're saying put aside those colas and the junk food, and it's the junk food that sometimes costs more money at the grocery store than the good things.
Absolutely. So junk food has a lot of saturated fats as well as trans fats in them, which are the fats that worsen your bad cholesterol, that clog up your arteries as you get older. So if you can limit those junk foods and really choose the fresh fruits, fresh vegetables as your snacks, that's going to be much healthier for you in the long run. And then you mentioned colas as well. So the sodas, the juices, they have a lot of sugar in them, but they don't have the nutrients that you need. So if you want some apple juice, eat an apple instead. If you want orange juice, eat an orange instead. That's going to be much healthier for you in the long run.
And if you buy the fresh fruits and vegetables when they're in season, they're usually less expensive.
Absolutely.
And of course the frozen ones are all right too, aren't they?
They are. The frozen vegetables that are just the vegetables themselves, not pre-prepared, but just the vegetables themselves can be a great source of nutrients and vitamins.
Now, you have a special interest in pediatrics.
I do. So as part of my practice, we see babies all the way up to adults. So I did training in both pediatrics and internal medicine, so I can see the whole family. But as part of that, you see how the decisions made in childhood affect kids and families for the rest of their lives. So eating healthy in childhood and being physically active in childhood is important to maintain a healthy weight and to prevent things like diabetes, heart disease, high cholesterol later on down the road.
Well, you sort of said the magic word, because it does seem that there is like an epidemic of diabetes and among small children that we didn't used to see.
Right.
Am I right?
Right. We are seeing more and more type 2 diabetes develop in our young adolescents, teenagers.
Explain.
Yes. So type 1.
Type 1 and type 2.
So type 1 diabetes is an autoimmune process that's triggered by the body. The folks who have type 1 diabetes a lot of times are healthy weight. There may not have been anything they could do to prevent the onset of type 1 diabetes. Those folks require lifelong insulin.
Yeah.
For type 2 diabetes, it's really a process that occurs over the years. So there is a genetic predisposition to type 2 diabetes. It does run in families. But what happens is as folks make those poor decisions, gain weight over time, aren't physically active, their bodies become more and more resistant to insulin. And eventually, the more resistant their body becomes to insulin, the more strain that is being put on their pancreas to produce insulin. And over time, their pancreas cannot produce enough insulin to keep up with the insulin needs that they have. So it's important to prevent type 2 diabetes, to prevent that insulin resistance from developing by being physically active, eating the right foods, maintaining a healthy weight.
And that, yeah, because so many times, not always, but many times people who struggle with diabetes and are under medication for it on a daily basis, they have a weight problem that goes hand in hand with it. Now, so reducing your weight, if you are overweight, can help avoid the onset of diabetes?
Yes, so certainly some folks, even with a healthy weight, could develop type 2 diabetes, but we know that the more overweight someone is, the more likely they are to develop diabetes, the more predisposed they are to develop diabetes.
What do you think stress plays? Now, I'm not talking about little children, but we live stressful lives. Most people,
Yeah,
in one way or another.
yeah,
Trying to do too many things.
right.
Trying to succeed, which is fine, that's good, but stress plays a part in our daily existence.
Absolutely.
And how important is stress in causing, in your opinion, situations that affect the body?
Right. So there's no doubt that there's a relation between our mind and our body. Okay. So with stress, some folks respond to stress by eating. So usually those are unhealthy choices, like we spoke about. So if you're stress eating, you're certainly
So if you're really upset about something, or you're really, stressed out, you'll pick up that.
A lot of times you won't pick up the healthy foods, you'll pick up the comfort food. Stress also, we know, raises your heart rate, raises your cortisol, your stress hormones in your body, and all of that puts a strain on your body and can take a toll in the long run on your health.
And it also takes a toll on sleeping.
Absolutely, absolutely. So if you're not calm at night, it certainly can be harder to sleep. And we know that it's important to get restful sleep in order to, again, maintain the health of your body, make those healthy decisions the next day, have the energy the next day to be physically active, and make those healthy decisions.
I have one friend who simply will not watch the evening news because she says it gets her so upset that she can't go to sleep. And you can laugh, but when you drink all that bad things into your mind, I guess it can be a cause for restlessness.
Sure, absolutely. So definitely important to try to reduce the stress in your life. So exercise can help reduce the amount of stress in your life by maintaining a healthy body. That can help reduce the stress in your life. Getting enough sleep is important in reducing stress. And certainly for many of us, prayer is where we turn when we need to reduce the stress in our life.
So maybe we should say to that friend of mine, it's okay not to watch the evening news, but maybe you say a few prayers along with
Right.
it, and you can help all those people on the news who are in trouble.
Right.
So let's go back to small children. Suppose we, have a mother out there with a very small child or a new baby. You have all that responsibility. What are the main things they need to consider?
So they need to take care of themselves. because they're never going to be able to take care of their child if they're not able to take care of themselves.
right.
So, and it is important. Don't be afraid to ask for help. Those first few months of being a new mom is a very stressful time. So don't be afraid to ask a friend or a family member to help you out. Take that newborn for a few hours for you so that you can get some rest and do things that are healthy for yourself. But also it's important to, again, develop those healthy habits early on. So in the newborn period, obviously the child is taking formula or breast milk, but as they get older, you want to offer them those healthy snack options. Try to offer fruits, veggies, yogurt, lean meats, whole grains, things that will help them to develop the taste for those healthy foods later on down the road. Try to avoid the fast foods, the fried foods, more of the processed foods that they can become used to and then have a harder time getting off of as they get older. It's also important for you to ask your pediatrician, is my child a healthy weight? So we calculate something called BMI, or body mass index, for every child based on their height, their weight, and then we compare that to national averages. So looking at, are they a healthy weight for their age, the fact that they're a boy or a girl, and for their height. And that's very important in predicting long-term health risks. So if we can keep them at a healthy BMI when they're young, usually we're able to keep them on that path as they get older.
So in other words, you can take a child of 6 months, and you can say, well, this child should weigh approximately, give or take 2 or 3 pounds.
Right. So we have growth charts that help us in the first 2 years of life. We actually start calculating BMI starting at age 2, and that's when we can say your child weighs too much, too little, or is in that perfect range.
So that you can address that when the child is small,
Very
and
young.
not let it
Right.
graduate so that they
Exactly.
have maybe enormous problems later on.
Exactly. And it's so much easier to develop those healthy habits when you start out with good habits than to start with bad habits and then have to change those later on as they get older.
Okay, we're going to take a quick break and come back, and we do have that phone number, 864-454-6440. Okay, we'll be right back.